Well, good morning, everyone, and thank you for coming. I am Dr. Trina Abla. I serve as the System Chief Medical Officer for Penn Highlands Healthcare. Thank you for joining us today to learn about rural healthcare here in Pennsylvania. On behalf of Penn Highlands, I wish to thank the Pennsylvania Department of Health for selecting Penn Highlands Tyrone as a site for today's news conference. Penn Highlands Healthcare Hospitals, which are located in rural communities, are the lifeblood of these local communities and local economies because in many cases we are the largest employers. We play a significant role in attracting business and industry to spur economic development, and without hospitals, many small towns would not exist. Having a hospital nearby is a sign of community vitality. According to the Hospital and Health System Association of Pennsylvania, in fiscal year 2023, Penn Highlands Healthcare hospitals in northwestern, central, and southwestern Pennsylvania represented a total benefit of nearly $2 billion to the Pennsylvania economy. This benefit includes approximately $919 million in spending by hospitals for goods and services needed to provide healthcare services and support hospital operations, as well as employee salaries, wages, and benefits. Despite being a major economic generator throughout the Commonwealth, our 9 hospitals, like many other hospitals, rural hospitals in Pennsylvania and throughout the United States, face unprecedented challenges. Rural hospitals have been facing substantial cost increases for labor, drugs, supplies, coupled with inadequate reimbursement rates and ongoing staffing shortages, recruitment and retention. We are struggling financially. According to reports published by the Hospital and Healthcare System Association of Pennsylvania, which is commonly referred to as HAP, Pennsylvania as a whole has had some of the most severe shortages of healthcare professionals in the nation. Approximately 65% of rural areas in the United States face a shortage of primary care physicians. And it is interesting to note that roughly only 10% of our doctors choose to practice in rural settings, despite more than 20% of the U.S. population living in rural communities. The shortage of skilled physicians and providers means that rural residents are sometimes required to travel long distances for access to basic medical care. Physicians in rural communities often treat patients that tend to be older, sicker, and less well insured. Populations in rural communities are increasingly elderly. Many patients in rural communities also suffer from multiple chronic diseases and acutely feel the various social determinants of health that impact their well-being, such as social isolation and lack of access to affordable, nutritious food. It is also important to note that the Association of the American Medical Colleges reports that many rural physicians are nearing retirement age, and nearly 25% fewer may be practicing in the next 5 years. It is becoming increasingly challenging to attract young doctors to serve in rural areas. Rural hospitals face an uncertain future without increased support from our state and federal governments. Over 100 rural hospitals in the U.S. have closed over the past decade, and 600 additional rural hospitals, 30% of all rural hospitals in the country, are at risk of closing in the near future. With each closure, Pennsylvanians lose access to essential services and communities lose a central component of their economic vitality. Rural hospital closures are associated with higher mortality rates, and closures typically affect per capita income and unemployment rates in their regions. The primary cause of rural hospital closures is that the payments from health insurance plans are inadequate to sustain essential services. Current state and federal programs do not solve the problems facing rural hospitals today. Rural hospitals need both adequate payments and a better payment system in order to provide essential healthcare services for their communities. As the population continues to age, especially in rural communities across Pennsylvania, reimbursement for healthcare services continues to shift to governmental payers, Medicare and Medicaid, typically which pay at 10 to 15% below cost. Typically, 70% or more of patients we serve have either Medicare or Medicaid coverage. Thus, by default, rural hospitals rely heavily on commercial payer contracts to subsidize the lack of reimbursement from government payers. It is not just the reimbursements. The record-setting inflation has spiked the cost of medications and other supplies and triggered pressure on wages, forcing hospitals to increase wages with little or no increase in reimbursement. More than 1/3 of the rural hospitals that remain open have been losing money. This needs to stop. Rural healthcare is an important part of the quality of life for the residents of Pennsylvania and the state's economy. Speaking on behalf of Penn Highlands Healthcare, we are committed to ensuring that people in the regions we serve have access to quality care in their community. It is now my pleasure to introduce Dr. Deborah Bogan, Pennsylvania Secretary of Health.
Good morning. Thank you so much, Dr. Abla, for sharing your really insightful remarks about rural healthcare and for doing the work here in the rural parts of the state across the system. So, without rural hospitals like Penn Highlands Tyrone, access to care for many Pennsylvanians would be significantly more challenging. And as Dr. Abla mentioned, I'm Dr. Deborah Bogan. I'm Pennsylvania's Secretary of Health. My friend and colleague, Secretary of Human Services, Dr. Val Arkush, and I are here to highlight the proposed investments that Governor Josh Shapiro wants to make across the state's rural health landscape in the next budget cycle. Pennsylvania is facing shortages of healthcare professionals, particularly in rural communities where there's currently about one primary care physician for every 522 residents. For comparison, in urban areas of the state, there is about one primary care physician for every 222 residents. That is fewer than half as many providers per resident in rural areas. So how does this impact Pennsylvanians living in rural communities? Well, for one thing, as Dr. Abla said, we know they already have to travel farther to get to see their doctors, but they also have fewer to choose from when trying to access care. In the past 2 years, I visited about a dozen of Commonwealth's 60-plus rural hospitals, and I've heard firsthand from hospital leaders and staff from across the state. They've told me about their challenges related to workforce retention and recruitment. They've shared their struggles related to accessing capital for necessary improvements in their facilities. Additionally, they've explained their need for more essential support services for patients after discharge from the hospital. So not only have I heard you, Governor Shapiro has heard you, as has Secretary Arkush. In fact, last year, Governor Shapiro's administration convened a rural healthcare working group comprised of stakeholders from state government, private sector, healthcare, and others. The governor attended that first meeting and tasked the group with developing Pennsylvania-specific solutions to address rural health access. And Secretary Arkush and I were both there and are part of the ongoing work in this initiative. So, meanwhile, in the governor's 2025-2026 proposed budget address, his budget addresses many of the challenges facing Pennsylvania's rural hospitals through a multi-pronged approach. First, the budget seeks $5 million to expand the Department of Health's primary care loan repayment program. This highly successful program offers loan repayments to healthcare providers in rural communities, such as this one. Currently, the program is assisting 19 healthcare providers here in the greater Blair County region, and more than 200 doctors, nurses, dentists, psychologists, and other healthcare professionals across the state. Besides the financial incentive associated with the program that encourages healthcare providers to serve in rural parts of the state, over the years, we've also learned something else. The primary care loan repayment program might get them in the door, but it's the genuine love for the communities, these great rural communities, that keep them here for the long term. And with beautiful communities like this in Tyrone, how can you blame them? The governor's proposed budget, in addition to the loan repayment, also invests $10 million in hospitals statewide through the Department of Human Services to assist the Commonwealth in responding to urgent consumer health needs and staffing requirements. But I'll let Dr. Akush tell you more about that. The budget will also allocate $5 million to educate, train, and recruit nursing professionals through tuition support, thereby ensuring steady pipeline of highly trained professionals for our rural hospitals. Now it is time to demonstrate to our rural hospitals and our rural residents that we understand the challenges they face and are here to support them. That is precisely what the governor's proposed budget does. It provides rural hospitals with the resources they need to retain and recruit quality employees and to help keep their doors open to serve their communities with the care they need and deserve. So thank you for hosting us here today. Thank you for really being available and open. And now I'd like to introduce Pennsylvania Secretary of Human Services, Dr. Val Arkush.
Thank you. Good morning, everybody. It is so nice to be here with all of you. Secretary Bogan, thank you so much for including me in this event. It's wonderful to be here. And I just hope everybody realizes how closely that we are working together across agencies in the Commonwealth. Also very involved in this work is the Pennsylvania Insurance Department, led by Commissioner Mike Humphreys, our Department of Aging with Secretary Jason Kavulich, and our Department of Drug and Alcohol Programs with Secretary Latika Davis-Jones. So we are really all doing this work together. But you got the two of us today. And of course, Dr. Abla, thank you so much for hosting us here. We're really grateful that Penn Highlands opened their doors to us and let us just share a few thoughts and words with you today. And of course, obviously, this gives us an opportunity to just get to know another rural hospital a little bit better so we can carry that message forward as we do our work. We know that the work that you do every single day is vital to ensuring the health and well-being of this community. And the Department of Human Services is grateful to our rural health care providers, like all of you here at Penn Highlands Tyrone, for all that you do to be sure that people are healthy and that they can thrive. I served for 8 years as a county commissioner in Montgomery County before being appointed secretary of the Department of Human Services. But prior to moving into public service like Dr. Bogan, I practiced medicine. And I'm an obstetric anesthesiologist by training. And while much of my medical career was spent in teaching hospitals in Philadelphia, I actually grew up in Nebraska, and I went to the University of Nebraska College of Medicine. And so my medical education was fundamentally informed by what it is like to practice in a rural hospital and some of the many challenges to healthcare that individuals who reside in rural communities face. So we all know how critically important it is to make sure that every resident in the Commonwealth has access to timely care no matter where they live. And of course, this includes individuals who are served through our Medicaid program. The Department of Human Services administers the Medicaid program in Pennsylvania. More than 26% of Medicaid recipients reside in rural communities across our Commonwealth, including nearly 330,000 children and more than 80,000 older Pennsylvanians. In Blair County alone, 28% of the residents are Medicaid recipients, which is nearly 34,000 people right here in Blair. But these are more than just statistics. These are people. These are our friends, our neighbors, our family, our coworkers, people who are vital to the functioning of our communities. They all rely on Medicaid to make sure that they and their families stay healthy. Without these critical health care services like Penn Highlands provide locally, too many rural Pennsylvanians have to drive very long distances, as Secretary Bogan alluded to, sometimes more than an hour, sometimes even two, to get the care that they need. And we can all agree that this is unacceptable. So that's why I am so proud to be working with Governor Shapiro and this entire administration to continue to further the work over the last 2 years to recognize and support the valuable role that rural hospitals have in our communities. Often, as you heard, while operating under great financial strain. Last year, the 2024-2025 state budget included $10 million to help support and stabilize our rural hospitals. This investment of state funds, $10 million of state funds, if approved by the Center for Medicare and Medicaid Services, will enable the Department of Human Services to draw federal matching funds to make that a total of $37 million to support access to hospital care in rural communities. And we're hoping to get that sign off from CMS in the next few weeks. But we also know that we need to do more. So as you heard, in his proposed budget for 25-26, the governor's proposing to continue the support of rural hospitals through an additional $10 million that we could use to draw down federal matching funds. And we estimate that for the 25-26 year, it would total about $35 million. The governor is also proposing an additional $10 million in state funds to be used to support hospitals all across Pennsylvania. So not necessarily our most rural hospitals, but some of those sort of borderline suburban hospitals and even some suburban and urban hospitals that serve communities that are in need of these services. Additionally, this year, the Department of Human Services initiated increased payments to critical access hospitals like Penn Highlands Tyrone by transitioning something called a disproportionate share payment that these hospitals receive to a state-directed payment beginning January 1st in 2025. This transition is also still waiting for federal approval, but we believe we'll get that approval, and that will result, in addition to that first $10 million that I mentioned, the state being able to invest a total of $60 million more during 2025 than we were able to invest in our rural hospitals in 2024. So it starts to fill some of those gaps, Dr. Abela, that you so carefully described. These targeted resources recognize the essential role that rural hospitals have in our communities. We know that their role is much larger than just the health care they provide. While that is essential, community hospitals are often the economic engines of their communities. They're often the top employer, and they're absolutely critical to recruiting young families and businesses to move to a particular community. So we know how important these hospitals are, and we want to do everything that we can to ensure that they grow and thrive. This combination of state and federal investments supports access to care and better health for millions in every community of our Commonwealth. It also supports the viability of our healthcare system, contributes to healthy kids and a healthy workforce, and significantly contributes to our overall economy. Additionally, under the previous administration, Pennsylvania implemented Medicaid expansion as part of the Affordable Care Act. As of 2023, hospital uncompensated care is nearly 28% less than it was before the Medicaid expansion, even though healthcare costs have increased during this time. Medicaid expansion is a critical piece of the infrastructure supporting rural hospitals and healthcare systems, enabling them to remain open and available in their communities and to continue to serve their neighbors. A strong, accessible, affordable healthcare system is the foundation of any community. Without a strong healthcare presence, we're not going to attract those new investments, those new businesses, foster that economic development, and keep and attract new residents to these communities. Healthcare is essential to both chart a new future for communities that are struggling and support communities that are already strong. Simply put, when we invest in rural healthcare, every Pennsylvanian benefits. I look forward to continuing to work with our local hospitals. As Secretary Bogan discussed, we have a very robust effort going on across agencies and with the governor's office to focus attention on how to help grow and stabilize our rural hospitals. The Department of Human Services is deeply and eagerly committed to this work, and we continue to work with our rural hospitals to make this work a success. Thank you. Dr. Bogan? Are we just going to stay? Yeah, okay, perfect. I'll just stay then.
Well, just in case I have questions for you.
Yeah.
So thank you so much for being here today. Thank you to Penn Highlands for hosting us here. We'd be happy to take any questions there are.
How confident are you that Shapiro's budget proposal, with all of these investments the hospitals will go through, considering state Republicans have pretty overwhelmingly said he's just asking for too much and it's just too big of a budget increase to ask for?
So the budget is a negotiation process, and we're hopeful that they will see this is a really important investment in rural communities. And that is not just a priority for the governor. We know it's a priority for those who serve rural communities as well. So we hope that those negotiations will go well and that they will support the rural communities. Again, as Dr. Akush said, rural hospitals are the lifeblood of rural communities. And so it is a wise investment to invest in healthcare in your communities. You get young families that are willing to come in. And so we're excited about the proposal. We think it's common sense and look forward to seeing the outcome. Want to add anything to that?
No.
Okay.
To what she said, how do we get Republicans and Democrats to agree, say this is not a partisan issue, it's a bipartisan issue? Because this problem affects Democrats and Republicans. Let's face it, it does. How do we get them to work together and come to some sort of an agreement?
Well, that is, the governor has talked a lot about bipartisan relationship building, understanding each other's points of views and coming together to understand it. But as we've made clear, and I think Dr. Abla's comments really made clear, Dr. Arkush's, this is a unifying issue, right? Rural hospitals are part of the economic growth of a community. They support people. Doesn't matter, when you show up at a hospital, nobody asks your political affiliation. They take care of you. And that's what hospitals are for. So that's why this is a nonpartisan issue. Taking care of people is a nonpartisan issue.
Yeah, I couldn't agree more. No illness cares who you voted for. I mean, that's just the bottom line. And so we have to make sure that these resources are here for everyone. And the economic benefits from having a hospital in a rural community also cross any kind of party line. This is just fundamental core work to ensure that our rural communities grow and thrive.
You mentioned a lot of different numbers, matching funds, 60 million more and all that. Exactly how would that be used for like a hospital such as in Tyrone? Will they apply for grants for the funding, or exactly where would it go?
Yeah, that's a great question. So with the two payments that I discussed, one is a DISH payment, what had historically been a disproportionate share hospital payment. Those are hospital payments, that come from the federal government for hospitals that provide uncompensated care. Because even though the Medicaid expansion has reduced our uninsured rate here in the Commonwealth by 50%, it's down to just under 5%. Hospitals still do provide uncompensated care. So that's what that payment is for. And by taking that payment and converting it to something called a state-directed payment, we're able to draw down federal dollars with those to match those dollars and increase the amount of that DISH payment. So that in total, we can get you the exact numbers, but that in total is about $25 or $28 million. And that gets allocated in the same way that kind of the regular DISH formula gets allocated to each of the hospitals. For that $10 million payment that was in the 24-25 budget year, the year that we're currently in from the state budget, that $10 million is also being used to draw down federal dollars, and that money is being distributed through a plan that was developed by the Department of Human Services with the support and cooperation of the Hospital and Healthcare Association of Pennsylvania, and also with the support of a variety of legislators who are engaged in this issue. And that money is being distributed proportionately based on a number of factors, including whether or not the hospital does obstetrics, whether or not they were participating in something called the Pennsylvania Rural Health Model, which was a model that a number of our rural hospitals were part of. If you're a critical access hospital, if you're in that sort of geographically isolated area and you're a critical hospital, if you see above a certain percentage of Medicare and Medicaid patients, you would get a portion of this. And then there's a measure for just sort of overall conditions in a community. So all those things come together into a formula, and that's how those dollars will be distributed to hospitals. So in both of those cases, we are still waiting to get final federal approval. As is often the case with a change in administration, sometimes things get a little slowed up as personnel changes and other things happen. But we're very optimistic that both of those will be approved, hopefully in the next month or two. Yeah.
Yes.
One issue that I've been seeing increase is related to hospitals is the closure of some emergency services like ambulance services, especially in rural areas, having to like consolidate and cover a larger area. So I just wanted to know if there's anything in the budget to like help offset that, because like residents are concerned that with these ambulance services having to cover a wider area, that the response times are going to be lower to get to them and then to the hospital, if that makes sense.
Yes,
Yeah.
absolutely. So the Department of Health does oversee the Bureau of Emergency Medical Services, EMS, and we are definitely looking at all areas to try to make sure that access is available. We fund those. Those are funded through a variety of mechanisms. But again, it is an important issue, one that we're considering and trying to figure out what are all of our options, and look forward to coming out with a plan over the next while to really address it. It is an issue in rural communities specifically, as you have to transport patients farther and farther affray to issues. We want to make sure that every community has a robust response. When you and I call 911, we want somebody to show up. We want them to be well-trained and timely. So we recognize that there are some challenges in some of our communities across the state that need to be addressed. So, yeah, look forward to that.
And then to add to that, in the Medicaid program, we did put through a pretty substantial rate increase if the patient being transported is in our Medicaid program. And again, we can get you those numbers, but we got sign off on that from the federal government and have been starting to implement those new rates. They will be retroactive to January 1st of 2025. And we're hoping that that will also help our rural EMS providers. Yeah.
Anything else?
Sorry. So even outside of the budget, I know that pretty soon there's going to be a 7-county maternity care desert in our northern counties. So is there anything more immediate being done to address that? Because I know a lot of people up in, like Coudersport, Kane, Bradford, Warren are just really scared for the future of their communities.
Yeah, we know that maternal care is really essential. Dr. Akush is a OB anesthesiologist, and I am a pediatrician. So these are really important issues to us personally, professionally, as well as to the governor. We are working on making sure we can't prevent hospital closure. That's not the role of the department. But we certainly are looking at ways to support hospitals in the future to really remain robust, as Dr. Akush has laid out some of those plans. We also are working, again, on the EMS issue, really to make sure that our EMS providers in those communities are well-trained in obstetric care, because if they have to transport patients farther, we want to make sure they're comfortable, making sure our emergency departments across the state are prepared to handle OB as well. Ideally, people get excellent prenatal care, quality care in their communities, and deliver at a hospital where they have appropriate services. But again, the transportation issue to those hospitals remains a challenge. And we share those concerns and look forward to working on those issues. They're part of the rural hospital challenges that we're all facing. If you'd like to add anything.
Yeah, I just want to underscore that this has been a real priority for both us and Governor Shapiro. And we're looking at lots of different models. If there's ways that we can assist and support innovative ways that hospitals are thinking about providing these services, you know, maybe, as Secretary Bogan said, that antenatal and postnatal care really close to home, maybe then with a plan to deliver a little further away. But it's all planned. You know, there's a transportation plan in place. We don't want people in labor to have to scramble to figure out how to get to where they're going to deliver. So we're very engaged in that work, but don't have any definitive plans yet for some of those counties. Yeah.
All right. Well, thank you again so much for being here for this important topic and spreading the word that we all need to work together to ensure that all of our rural hospitals stay robust and can serve their communities. So thank you.
Thank you.
Get your
Yes.
I'm Dr. Trina Abla, that's TrinaAbla, and I serve as the System Chief Medical Officer for Penn Highlands. It is critically important to Penn Highlands Healthcare that we have the support of the Shapiro Administration. We're facing unprecedented financial challenges to be able to operate the hospitals that we serve in the rural communities that we serve. From a reimbursement standpoint, simply put, we do not receive enough to cover the cost of labor, supplies, and services that we provide for these communities. Not only do we provide the health care for the communities, in many of our communities, we are the economic driver. We are the largest employer, and we're critical to the vitality and continued vitality of the rural communities that we serve.